Hello, everybody. Thanks for the patience. Had a little bit of technical difficulties to start, but thanks for joining today. We've had a lot of feedback for these Wayland universities, whether they can listen in live or they can watch on our YouTube page. So if you know anybody that wants to learn about the rising healthcare costs or any of the other presentations that we hosted over the last few months, make sure you just go to YouTube and search for Wayland Financial. That'll bring up our page, and you can see pre-recorded versions or recorded versions of any of these webinars. So I do want to welcome everybody. Today, we're going to talk about how the cost of healthcare could impact you during retirement. And after today's webinar, hopefully you will have a better understanding of the impact of those costs and the strategies to help manage some of these rising costs and overall retirement strategies. So before I begin, I do have to go over a little bit of the disclosure that this content is for general informational purposes only. It is not intended to provide fiduciary tax or legal advice and cannot be used to avoid tax penalties, nor is it intended to market, promote, or recommend any tax plan or arrangement. Allianz Life Insurance Company of North America and their affiliates and their employees and representatives do not give legal or tax advice related to Medicare or Social Security benefits. You are encouraged to consult with your own legal, tax, and financial professionals for any specific advice or product recommendations, or to go to your local Social Security Administration office regarding your particular situation. Okay, now that the fun stuff's out of the way, we kind of want to get right into it. So let's first start with why one should be concerned with healthcare cost. 3.6 trillion was reported as the national health spending cost in 2018. And this fear is founded to some extent because health spending grew at an average rate of 4.5% from 2016 to 2018. That averages about $11,172 per person in 2018, according to the latest Centers of Medicare and Medicaid Office's actuarial release. So we can see 3.6 trillion in national spending in 2018, 4.5% growth from 2016 to 2018, and about 11,172 per person in the last study that was conducted. So cost of healthcare in retirement is concerning. Here's another reason why healthcare in retirement can be concerning. One could argue that healthcare costs are an expenditure that grows significantly in comparison to other expenditures and is the most impacted by inflation risk. So according to a Kaiser Family Foundation and HRET survey of employee-sponsored health benefits from 2009 to 2019, what's interesting about this is that if everybody remembers what happened on March 23rd, 2010, so March 23rd, 2010, for those of you who don't know, was the day the ACA was passed. That is what's known as the Affordable Care Act. It was one of the milestones during the Obama administration, and that was passed in March 23rd, 2010. Now, despite that affordable care, what's interesting here is overall inflation during that time has increased about 20%. Luckily, wages have increased slightly more than that by about 26%. That's what we want to see. We want to see employees' wages growing at more than what overall inflation is. But healthcare premiums for family coverage have increased 54% over that same time period. And what's even more shocking is the most dramatic increase for healthcare deductibles coming in at 162% increase from 2009 to 2019. So people used to worry about dying too soon. And sometimes they would rely on politicians to pass legislation to bring down the cost of healthcare. I mean, that was the big thing about the Affordable Care Act, expanding healthcare coverage and bringing costs down on individuals. Well, we can see just from this unbiased statistic that there was a 54% increase from 2009 to 2019 in family premiums. And there was a 162% increase in those deductibles. So like I said, people used to be worrying about dying too soon. Now they're worried about living too long and paying for their healthcare coverage. So obviously a big concern for people in retirement is healthcare expenses, which are much higher for those age 65 and older. And according to the latest 2019 Bureau of Labor Statistics survey, over 13%, 13.4 to be exact, of their incomes on average are going to healthcare expenses, which is up from 8% for all ages. So you can see where a significant amount of spending is for people 65 and older. That's in housing and healthcare. But it's a significant difference 65 and older compared to all other ages. As you can see, 8.1 versus 13.4. So now that we know that healthcare costs could be concerning to you and that the risk is absolutely real, what we want to do is discuss how you can help mitigate these costs by utilizing just 3 steps. So the first step today in today's agenda is to demonstrate how healthcare in retirement works, so you have a basic foundational understanding. Number 2 is to show the potential costs and impacts of healthcare coverage. And if we can do 1 and 2, then we should be able to do number 3, which is try and develop a strategy to help cover potential out-of-pocket expenses. So let's take a look at each of these steps in a little bit greater detail. So the first one, starting with demonstrating how healthcare coverage in retirement works. And by all means, I am no Medicare expert. That's what we use a team of our professionals to help navigate some of those waters for our clients so they make the best financial decisions. If you're on the cusp of getting into Medicare, make sure you give us a call. Or if you just want to look at different plans, we have the resources to be able to shop those to help potentially bring you a better solution. So we'll start with Medicare. The good news for some people retiring at 65 or later is that individuals become eligible for Medicare on the first day of the month they turn age 65. So if you're already receiving Social Security benefits, you are automatically enrolled. For those of you receiving Social Security, their Part B premiums are withheld from your Social Security check. If you are not receiving your Social Security benefits, you must enroll to receive the Medicare benefits. When you enroll, you can affect your Medicare Part B premium. So it's important for you to enroll when you turn 65, because if you delay and you do not turn on enroll for Medicare at 65, you may pay higher premiums moving forward. There are 2 main ways to get Medicare coverage. First, you must choose from Original Medicare or Medicare Advantage plan, which is like an HMO or a PPO. Medicare Advantage is the privatization of Medicare, meaning Medicare pays private health insurance companies to cover Medicare-eligible persons. So while Original Medicare is standardized, Medicare Advantage plans can vary greatly from carrier to carrier. So whether that would be a United or Humana and AARP, those are all Medicare Advantage plans. And Medicare Advantage typically has lower premiums than Original Medicare, but that comes with less flexibility. So a Medicare Advantage plan is a network-based plan, so insureds are limited to the plan and its network of doctors and specialists. Remember, I said it limits the flexibility. Under Original Medicare Part A, that part is free, but there are deductibles and copays. It pays for some of the cost of hospitalization, limited skilled nursing care, hospice care, and home health care. Part B primarily covers physician services, most outpatient hospital services, and certain related services. Long-term nursing home care is currently not covered. So long-term nursing home care is not covered under that plan. There is a premium for Part B coverage, okay? Part C includes managed care plans, so private fee-for-service plans and medical savings accounts. It may offer extra coverage such as vision, dental, or health and wellness programs. With Medicare Advantage plans, Part C is usually a combination of A, B, and D. Okay? In Original Medicare, the second decision is whether or not to add prescription drug coverage, and it's voluntary. Part D, like I said, is voluntary prescription drug coverage. Most Medicare Advantage plans cover prescription drugs, but it can be added to some plans if not already included. So Part D is also means tested. A final decision for you is to do you need to add a supplemental coverage like Medigap, which is Medicare Supplement Insurance? If you join a Medicare Advantage plan, do you need and therefore can't buy a Medigap policy? And it's important you understand that Medicare does not cover everything. So, higher income Medicare beneficiaries are not held harmless. So there is a hold harmless rule that protects Social Security benefits from Medicare premium increases. But if you are a high income Medicare beneficiary, so if you're receiving Medicare and you're in a high income bracket, you are not held harmless and have been paying more for their Medicare Part B and D coverage for several years in the form of income-related monthly adjustment amounts. So the Medicare Access and CHIP Reauthorization Act of 2015, otherwise known as DocFix, law that was enacted, new maximum adjusted gross income tier brackets that went into effect starting in 2018 Medicare premium. So the 2018 tax return is used to set 2020 income-related monthly adjustment amounts. And those payments using this new tiered system to determine Medicare Part B premiums as well as Part D premiums, which is the next slide. So essentially, $144.60, if you're making over $87,000, is the hold harmless. If you're over that $87,000 and married filing jointly over $174, it's standard. But then you pay 1.4 times if you're above those income levels. So you can see on the left, the income levels on the left and what the 2020 not held harmless level of the premium is. Okay, so that's for Medicare Part B. If we go to Medicare Part D, which is prescription drugs, this chart illustrates how the means tested Medicare Part D premium cost also rises with the recipient's modified adjusted gross income, or MAGI. The modified adjusted gross income includes adjusted gross income plus tax-exempt income like municipal bond interest. So higher income brackets pay higher premiums. Okay, that's how this works. Income reported on the client's federal tax return from 2 years ago, 2018, is generally used to determine the Part D premiums for the current year, which is 2020. If you guys are married and lived with their spouse at some time during that taxable year but filed separate tax returns, the numbers will vary from above. But you can go to Medicare.gov to get the specific details if that's your specific case. And just as Part B premiums are affected by prior tax returns, with Part D premiums, clients should be cautious of increasing their adjusted gross income as a result of a Roth IRA conversion and other increases during retirement that could affect their premiums. So also with Part B, when a client enrolls for Part D, that can affect Medicare Part D premiums. So what I want you to note is that the hold harmless rule does not apply to Medicare Part D premiums for prescription drugs. And if you make over a certain level of income, just like in the previous slide, in Medicare Part B as well. So even though you may be on Medicare at age 65 or older, you may need supplemental or personal Medigap policy. So a Medigap policy is not part of Medicare, but it is a policy purchased separately from an insurance company to cover what Medicare does not. So it covers some costs with Medicare does not, such as co-payments, co-insurance, and deductibles. Premiums vary on insurance company and extent of coverage, so it is important to ask how an insurance company prices its policies, as it will affect how much you pay now as well as in the future. So Medigap policies are a commodity type of product, meaning the plans are standardized, they all offer the same thing. Therefore, pricing is the one thing that differentiates the plans. One must know how the plan is priced in order to make a fair comparison. There are generally three types of Medigap pricing, which we'll go over on the next slide. But Medigap, those types of policies, help cover some co-payments, co-insurance, as well as deductibles. So now that we've covered at a very high level how healthcare in retirement works, let's attempt to quantify the cost of healthcare in retirement. So let's take a look at what this actually may mean to you in physical numbers. That's what we care about, actual dollars. So the projected annual healthcare cost for a healthy 65-year-old couple retiring last year is $12,286. Projected annual cost for them 20 years later in 2039 at age 85 is expected to be about $34,268. Now, all calculations are based on assumptions that the male life expectancy is 87 and the female lives to 89. In all of our analysis, we always kill off the male first and let the female client live a little bit longer. That's just how we've always done it in all of our analysis and financial modeling. But the projected lifetime retirement healthcare premium cost for a 65-year-old healthy couple retired in 2020 will be approximately $387,000. So you're saying, Andrew, $387,000, that's a tremendous amount of capital. I 100% agree. Now, what that includes is premiums for Medicare Part B, Part D, supplemental insurance, which is Medigap, dental insurance, out-of-pocket cost related to hospitalization, doctor visits, tests, prescription drugs, hearing services, hearing aids, vision, and dental. My point being is that it is a tremendous pit hole if not properly planned, whether that's in the accumulation of the assets or where we take distributions from the assets. So the projected lifetime healthcare expense for a 65-year-old today is about $387,000, okay? A 65-year-old couple, I apologize, is about $387,000. You don't always see it. Some of it comes out of Social Security, and some you pay direct. But that's the best estimate that we could see working with the 2019 Retirement Healthcare Cost Data Report that was provided by HealthView Services. So what is the financial impact, right? So what does healthcare cost an average worker? The average premium contributions last year in 2019 for all plan types covered by workers for singles are $1,242 annually. And for workers with families, $6,015 annually. But these numbers don't reflect the total cost of healthcare premiums. Employers contribute $5,946 for single coverage and $14,561 for family coverage. So total premium costs are $7,188 for single coverage and $20,576 of family coverage. So as you can see, employers often pay a large percentage of the premiums for their workers. Here we have a hypothetical example of healthcare premiums projected cost in 2020 for a retiree. So for an individual, premium cost would be approximately $3,751, bottom right-hand corner, for the total yearly cost. Thinking in terms of cost for a couple in retirement, that basically doubles. Roughly about $7,400, almost $7,500. However, that does not include all the deductibles and the copays, and it does not include dental, vision, or hearing coverages. Okay, the cost of Medicare can vary based off the plan type, the state of the resident, the assumptions used. It can be lower or higher depending on a lot of varying factors, which make it very important to have a healthcare cost strategy in place, right? So if we look just this year alone, Medicare Part A, and now this is all dependent upon income levels, Medicare Part A, $0. Medicare Part B, going to cost you $144 a month. Medicare Part D for prescriptions on average about $40 to $42 a month. And 2018 average Medigap is about $125 a month. So that comes out to about $312 a month for all of those monthly premiums, and that comes out to $3,751 on total annual costs for a single individual. So inflation and cost of adjustments are a big part, not only of Social Security, but also Medicare Part B. So this issue isn't likely to remedy itself over time. The average annual Social Security cost of living over the last 30 years has only been 2.4%. So what does that mean? Over the last 30 years, your Social Security check on average every single year has gone up about 2.4%. However, the annual Medicare Part B premium increase over the last 30 years was 4.5%. It's a pretty big adjustment. So Social Security checks aren't even keeping up with the cost of Medicare Part B premiums. And why is that a problem? Is because we saw how fast healthcare costs are rising in the country. That's more, I mean, if you look at that, that's more than double basically Social Security COLA. Therefore, though Social Security currently may help with the vast majority of Americans retire, they also need help from their financial professionals to determine strategies that can help meet these increasing healthcare costs. So in addition to Medicare cost and other out-of-pocket cost, annual long-term care costs for a client could be significant. So according to longtermcare.gov, someone turning 65 today has a 70% chance of needing some type of long-term care services and support in their remaining years. The average annual nursing home cost in the US in 2019 was $102,000, or roughly $8,517 a month. Now, that is a private room with 365 days of care. All of these things can be very different. So we're just looking at the average. But if you're turning 65 today, you've got a 70% chance of needing long-term care at some point in your life. And the average nursing home cost, which is a private room and 365 days of care, is about $8,500 a month, or roughly $102,000 a year. And Medicare does not cover nursing home costs. So, what have we done in our practice to look at some of these things? We talked about policies, whether that's index universal life policies or direct long-term care coverage policies if clients can qualify, where what we're doing is trying to leverage the cash that you have now for a future. Now, some of you have family members that you want to leave stuff to. Some of you don't and don't care if they get a nickel. And if the latter is the case, which is not the case for the majority of our clients, then that's fine. We spend down everything, we sell the home, and use all of that capital to live in a nursing care facility for, on average of about 3 to 4 years. But what we've tried to do over the last 5 or 6 years is proactively go through and see where we can strategically position some assets now to give up a little bit of growth, right? Where we may only make, 4 or 6%. Or 7% a year, depending on how well the year is, so that we can leverage that up for either a face amount or some type of long-term benefits. Because if we can use the advantage of leverage, then that is less depletion of portfolio assets, less for beneficiaries or for spouses in the event like something like that happens. So whether you're on here today or know somebody that isn't properly positioning themselves, just make sure you reach out to our office. We don't charge for consultation, so let us try and proactively help anyone that you know. Now, Medicare has a tool that can be used to find a Medigap policy that works best for you. So if you go to medicare.gov, select supplements and other insurance policies, then select find a Medigap policy option. This tool considers a person's zip code, the drugs you take, and the services they would like, and the tool shows options that may work. The available options also show the pricing. So another great resource that you can use and available on Medicare.gov is the Medicare and You Handbook. So this is published annually and can be downloaded or ordered in a variety of formats. And remember, us as your financial professionals can provide information, just not advice, related to Social Security and Medicare benefits. You should seek the guidance from Social Security Administration regarding your particular situation, and you can go to Social Security at ssa.gov. But make sure you write those down or write this down for individuals that are on the cusp of entering into Medicare. So medicare.gov, then select supplements and other insurance, then select find a Medigap policy. From there, you'll be able to fill out information and they'll tell you more about potential policies, as well as downloading the Medicare and You pamphlet or handbook so you can get more information. So now let's look at some of the ideas for creating a strategy to cover some of your healthcare costs in retirement. So first, we demonstrated how healthcare works in retirement, and I pointed out some useful resources for you, okay? So be proactive and discuss these costs with your team of professionals. That's the first piece of advice. Be proactive. Understand how healthcare cost and retirement may impact you, and be proactive and talk to us. Remember that the projected annual healthcare cost for a healthy 65-year-old retiring in 2019 is $12,286. All calculations are obviously based off of assumptions that the male lives to 87 and the female lives to 89. Okay. The projected lifetime retirement healthcare premium cost for a 65-year-old that's healthy in 2020 will be approximately $387,000. So in conclusion, develop a strategy that will help you mitigate the rising out-of-pocket healthcare expenses as well as inflation. So, and to speak to that more clearly, we try to build proactive portfolios that do suffer market corrections, that do go through bear markets, that may not be priced perfectly at all the times. But when we select individual positions for clients, whether that's in a technology name, an industrial name, we're really looking out for the next 5, 10, and 15 years. And the reason is if you are 65 today, you've got an average retirement of about 20 to 25, maybe even 30 years, God willing and health willing. And the only way to properly keep up with inflation is not to sit on the sideline and wait for the perfect time to enter into the market, or only be comfortable with a 4 or 5 or 6% rate of return, 4 or 5% rate of return, because it's not going to keep up with a portion of the portfolio that has to be used for healthcare. And if you have anything or anybody that needs help developing that, please give them a call, have them give us a call, or direct them to our YouTube page to watch this, and maybe they'll reach out to us. Here's the last set of legalese to keep everybody happy. And I do want to thank everybody for joining today. It's been a pleasure to spend about 30 minutes with you. Remember, give us a call, 866-600-3030. Email us at info@waylandfinancial.com. We're here for you, building your tomorrow together today. Have a nice day.